Hey everyone, this is Anand Bhatani, and today I want to discuss post-study patient recruitment analysis. It's a really interesting topic because we have to increasingly start to document how clinical research patient recruitment is turning out. We've got to keep good metrics because studies are becoming more and more complex and complicated. So you got to figure out, what tactics work for which kind of situations and what kind of studies, what therapeutic areas, and we got to have notes of these, detailed notes that we can not only share with the sponsor but keep internally for future projects, so we can have a sense of confidence as we take on new studies. There are a few details that I like to recommend that sites monitor and measure and keep internally, and that's the ROI on any technique, whether it's TV, radio, R methods, from trial join, or if they're provided even by the sponsor. You want to keep metrics of seeing how they work, and you want to keep notes of different scenarios they ran into when you use certain techniques. Maybe you saw a certain type of patients come from TV ads that you had to deal with a little bit differently than the ones that come from a radio ad. You may have to pre-screen them or walk them through certain steps. They may be a little bit more accustomed to clinical research if they come from online methods. You have to keep notes of things like this, so that way as you pass on the baton to other researchers, they know how to deal with those channels and methods, and they can be more and more effective for you. Other things you want to know are how long the patient actually stayed in the study, because that can be a important thing to know, because every patient is literally the same. So patients that might come from a TV advertisement as opposed to a trial join method might not stay in a study as long, versus trial joins patients will definitely stay in your study a little bit longer, because they have we create certain follow-up mechanisms to stay in touch with the patient, keep continually educating them about their condition and what clinical research is. And so that way, they're going to, feel more comfortable with staying in the study. They're going to be able to educate people around them what clinical research is, and also fight off any, negative connotations people might have about clinical research. Because if they know what clinical research is and they're able to explain it to the people around them, they're going to feel comfortable. So that's why you have to measure, multiple things, the ROI, how long they stay in study, different nuances of different channels and how you need to approach them. Maybe you have to pre-screen more, you have to educate more, stuff like that. So make sure you're keeping detailed notes and doing post-method and post-study analysis on every recruitment tactic and every study. And if you ever need a little bit of a note sheet, we have one prepared for you. So feel free to reach out to me at re@trialjoin.com, or give me a call at 415-851-3879, and I'll gladly help you out with our sheet, and I'll send it over to you and even walk you through steps that you should be doing as internal processes that you should implement with all staff and team members. Well, until our next session, I hope everyone enjoyed this. Have a good one. Bye.